Hello, I'm Dr. Sandip Bartakke. I'm pediatric hematologist at Ankura Hospital, Pune. Today we will talk about a disease called thalassemia. On 8th of May, we celebrated Thalassemia Day. So, what is thalassemia? So, thalassemia is the commonest genetic disorder. So, it is important to know about the thalassemia because it is one of the important causes of morbidity and mortality in children. Just to give an example, approximately 10 to 15,000 children are born with thalassemia major in our country, and approximately 3 to 4% of population is carrier for thalassemia gene. The thalassemia can be thalassemia minor or thalassemia carrier, or it can be thalassemia major. So about 3 to 4% of the population is thalassemia carrier or thalassemia minor, where one of the two beta globin genes is abnormal. Usually they don't have any symptoms except for little low hemoglobin, they are otherwise normal. But when the two thalassemia carriers marry, and then when they have a child, there is 1 in 4 chance the child may be born with thalassemia major. Now, thalassemia major is a serious blood disorder where the children require blood transfusion from early age, usually within first year, and they require blood transfusion every month to survive. Okay, so the current standard of care treatment for these children is regular, safe blood transfusion every monthly, and with this blood transfusion they develop overload of iron in their body, and then they require medicines to reduce this iron overload. Also, they require regular monitoring with the tests and regular follow-up with pediatric hematologist. Now, what is the curative option for thalassemia major? Current available curative option is bone marrow transplantation from matched family donor or matched unrelated donor. Now, matched family donor pool is restricted. Only 1 in 4 chance that the brother or sister can be a complete match. But what we can do is we can increase matched unrelated donor pool. How we can do that? We can actively register as a bone marrow stem cell donor with various registries which are available in our country. Now, there is also exciting news about gene therapy for thalassemia, and actually it has become a reality in Western countries, and hopefully gene therapy will also be available to us soon, which can also be curative for thalassemia. So the last but the most important part is prevention of thalassemia. How we can do that? So at the time of marriage, or at least when the lady is pregnant, during early pregnancy, we should check her status for thalassemia carrier. How can we do this? By a simple blood test. Now, if the lady is detected to be a carrier for thalassemia, we should check the husband's carrier status, and if husband is normal, there is no worry. But if husband is also thalassemia carrier, then we should go ahead and do the prenatal testing and check the fetus status. If fetus is affected with thalassemia major, there is option of medical termination of pregnancy. If fetus is not affected, then the pregnancy can be continued. So the prevention is the key in all of this. Okay. So in summary, I would say thalassemia is preventable. Thalassemia can be managed very well, and thalassemia can be cured with bone marrow transplantation and maybe with gene therapy.